So by now you've heard that Oregon has a chance to be the first state to move to universal healthcare, but have you actually done anything to help us get there? The monthly meeting of the Universal Health Plan Governance Board is on Thursday, October 16th, and we are mobilizing folks to submit their written testimony, register to speak remotely, and also carpool with us from Portland and from Corvallis and all across the state to arrive in Salem together to give testimony in person to the folks making our universal healthcare plan for every person in the state. If you are not sure what we mean by testimony, it really is public comments from people like you, people in the state of Oregon, about what a universal healthcare transition would mean. This month, we're specifically mobilizing union leaders to submit their testimony about what universal healthcare would mean for their unions, but you do not have to be a union member to submit your testimony. In fact, you don't actually have to know the details about the plan that they're forming because it still is in development. But if you have a body and you live in Oregon, you are affected by the healthcare decisions of this group, and you are affected by the eventual legislation that will come from their efforts. So if you think that universal healthcare is a great idea, you got to let them know. If you think it's a bad idea, well, you can just pipe down and not say anything, but you're welcome to give your comments. We are hosting a testimony workshop on October the 12th, which is the final day for folks who submit their written testimony to be considered for the Thursday the 16th session. The Universal Health Plan Governance Board needs to hear from you because they're working on a program for you. They want to know what you think about a potential universal healthcare transition for everybody in the state of Oregon. Submit your written comments by Sunday, October 12th. Submit your desire to speak over Zoom by Wednesday the 14th, or show up in person with us in Salem on Thursday the 16th and talk for 2 minutes about what you think a universal healthcare transition could do for you.